Hi, I'm Ursula, and my son Maximilian, is 8 years old, and we've been going to Dr. Neubrander for over 2 years now. He started with him in January 2003. Before that time, he was very hyper, had a lot of tantrums, wasn't doing well with communicating. He would have trouble. He would almost look like he knew what he wanted to say, but he couldn't quite find the words to say it. They wouldn't connect and come out correctly. When we first went to Dr. Neubrander, it was not to do the B12 shots. It was actually for other things like supplements and chelation. And at the very first appointment, he put out that we would need to do these methyl B12 injections. And I at first was very scared. I didn't think I could give a shot to my son when we started it was twice a week. I didn't think I would be able to do that. I was very scared about it. He has a very low tolerance for pain, so things that make him, when he gets hurt in the very smallest way, he often has very loud reactions to it. And so I was concerned about that. But reading through all of the letters and information that Dr. Neubrander had about it, I decided to go ahead and start him on the injections, and it was probably one of the best things we ever did. It's the one course of treatment that I think has really helped Max. He within 2 days of being on the shots, he was in BCIU at the time, and he had a note sent home from school that he had actually voiced to a friend that they were too close to him. His normal reaction would have been to hit them or push them, be very aggressive towards them, and instead he said, "You're too close," which was, at the time, was phenomenal for him to even say that. He started noticing things after he was getting the injections. We started noticing, like when we were driving places, he would look out the window and he would actually notice the construction that was happening and ask questions about it. What are they building? What are they doing? He'd never paid any attention to anything like that before. He started having conversations, back and forth conversations. He never really had good back and forth conversations before. He started being able to discuss with his friends about things that they could do together. Like if they wanted to draw a picture out on the sidewalk, what were they going to draw? He could actually do some give and take with his friends. And he also had a couple times where he was since he doesn't see his father often, he talks to him on the phone a lot. So at the time when he started receiving the shots, he was very reluctant to speak on the phone, didn't want to answer it. When he did, it was very one-word, short answer, yes, no, I don't know. And after being on the shots, it's 2 years later. At this point, it's been progressive, but at this point he can actually answer the telephone. If it's his father or if it's someone else, he can actually ask them who's calling and bring the phone to me and let me know who's on the phone. And when his father does call him, he can have an actual conversation with his father on the phone, and actually he tells him things now and asks him questions, and it's not just a one-sided conversation or him giving answers to the questions that he's saying. So that was really a very big step for Max since he's been getting the shots. His communication overall has improved since he started getting the shots. He does much better with his speech and coming up with words that he can say. Like before the shots, he would have a lot of trouble coming up with what he wanted to say. It would almost be like it was right there in his head and he couldn't quite get to it. And after he started the shots, then it was almost like a light switch was turned on, and he could actually find those words and be able to say what he wanted to say. when I give him the shots, it's at nighttime, and I wait till he's asleep. In the beginning, we started with the Emla cream and a Band-Aid on his bottom, and then I would take that off and give him the shot through that. It was never a problem, and pretty soon after, I think within a few months, I just stopped using the cream altogether. And at this point, I can go at night when I go to bed, and he's already been asleep for about 2 or 3 hours, and I can give him the shot, and he doesn't even wake up at this point. It doesn't bother him at all. He doesn't realize if he does wake up when I give it to him, it's usually like he does like one arch and he's back to sleep. He remembers nothing about the shot, so it's not traumatic to him in any way. And I do know since he's been on it for 2 years and he's been coming along, it's harder for me to say now where all his changes are coming from, if they are directly related to the shots, which I think they are, but it's not as obvious as it was back in the beginning when he first started on them. What I notice now is more what happens if he doesn't get the shots. And he actually, just this past week, went for 2 days past when he was supposed to get his shots because he was spending time with his father, who forgot to take the shot along with him. And when he came back, he was a complete mess. He was very hyper. He was screaming. He couldn't calm down and hold a normal conversation. He actually went to a speech group this past Monday, and his TSS was present, and his speech therapist and the other children in the group. And his TSS made a comment to me afterwards that it was like he was back at the beginning when he had started in the speech group over the summer. He had made such progress in the speech group, and he was one of the best in the group and could sit calmly and demonstrate self-control and be able to answer his therapist when he said something. And this past Monday when he was there, he was just, he had his hands in his mouth, he couldn't sit still, he couldn't remember within like a 30-second time frame from what the therapist asked him to do a greeting. He couldn't remember what she had said, and instead fell apart and started crying, and couldn't answer her on how to do a greeting. And both the therapist and his TSS commented on it. And that night I gave him the shot because I had him back, and the very next day he was completely different. And when his TSS came over that day after school, she said, "I can't believe the change in him from the day before. He was calmer, he wasn't screaming, he had more self-control, he didn't have to fidget, he was just much better overall the day after." And I've noticed that several times that he's gone when he's missed his shots, that happens. I've even noticed when he has a particularly bad day, they usually tend to be the days when his shots are due that evening. And then when he gets his shot, he's much better the next day. I really highly recommend it. I've been recommending it to people in our area to go see Dr. Neubrander and to get the methyl B12 injections, because I think they're definitely the one intervention that I can honestly say has really worked for Max and made a significant difference in his life. So I would highly recommend it to anybody who wants to try this method with their children, and I think you'll definitely see a difference with it. I'm convinced it works.